you suddenly packing on the pounds? You have no idea why. You haven't changed anything in your routine. Dr. Stephen Hotze of the Hotze Health and Wellness Center says it could be a symptom of an often misdiagnosed condition, hypothyroidism. I knew I was going to get it. Dr. Hotze came all the way from Houston, Texas to be with us today and to share your book, which is a must-read. Thank you so much for being here, Dr. Hotze. All right, so what is it? I can barely say it. Hypothyroidism. But I know a lot of women who have this condition. Right. What's it all about?
And there are a lot of women who have the condition that goes undiagnosed and unrecognized by their conventional physicians. Hypothyroid is a condition where an individual doesn't receive enough thyroid hormone into their cells, and that can be caused by a lack of production, adequate production by the thyroid gland itself, or some resistance at the cellular level or antibodies that block the thyroid from getting into the cells. Now, why is that important?
Yeah.
Thyroid hormones are what enable our cells, your cells, to produce and use energy. So they govern our metabolism.
Okay.
Every cell in the body requires thyroid hormones. If you don't get enough thyroid hormones into your cells, you run sluggish, and you get a host of symptoms. Fatigue, oftentimes difficulty with weight, although we've seen skinny people with hypothyroidism, cold sensitivity, insomnia, mood swings, panic attacks, anxiety attacks, joint muscle aches and pain, stomach disorders, hair falling out, puffy, pale, they get recurring and chronically sick, irregular menstrual cycles, brain fog. This is a host of problems that seem unrelated, but there's a common thread, and the common thread is a low thyroid condition.
I think there's so many women out there right now who are saying to themselves, oh my gosh, that's me. You know, they find that they're so sluggish and they can't do anything about it. You know, they try to get up and exercise, but it doesn't make a bit of difference. And how many ladies out there are thinking to themselves, yeah, I'm packing on pounds. I don't know why. There's nothing I'm doing in my routine.
Well, this is what commonly happens. As women mature in age, it happens to men too, but women, because they cycle every month and they have two major hormone groups they have to balance, estrogen and progesterone. As women age, their natural occurring hormones get imbalanced and they get in a state of estrogen dominance, which adversely affects the ability of the body to utilize thyroid hormones. And then they get these symptoms. They go to the physician draws the blood test, and what does the physician tell you? It's normal. And then he looks at you and says, but you know what? I think a little Prozac might help. And so all the women get placed on antidepressants thinking that they made up the problem, and then they start believing it, and it destroys their lives, it destroys their careers, their families, their marriages, and their confidence about themselves because they've been told they don't have a problem when they know they do have a problem, and the problem is low thyroid. That's why I've written this book. I'm passionate about this.
Yeah, I can tell.
Because we've seen 30,000 women and men at our center, at Hotze Health and Wellness Center, and treated for hypothyroidism. And the disaster stories their lives were before they were treated is sad. So I'm on a mission to teach the country about hypothyroidism and to give the natural approaches to hypothyroid. Here's the other thing that happens. Oftentimes, if they get diagnosed, they get put on the wrong medication. They get put on the synthetic thyroid rather than the natural desiccated thyroid. And I use the natural thyroid, which has been around 100 years, because it works.
Yeah.
So if you're having thyroid problems and hypothyroidism, taking synthetic thyroid is not working right, it's not working. You need to change.
So if you go to your doctor and you're having these symptoms and they say, oh, there's nothing wrong with you, you're fine, you need to go on Prozac or whatnot, should this be something that you're bringing up to your doctor and saying, hey, wait a minute, hold on, I was watching First Coast Living, I saw Dr. Hotze, should I get tested for this?
See what this is?
Yes.
This is
your guide.
No, right here. This is the book your doctor doesn't want you to read. So you need to find physicians. There are physicians here in town, I think a number of them, and I think Dr. Randolph is one here in town that deals with natural bioidentical hormones and with thyroid disorders. And so look for physicians that take a natural approach on thyroid. And as a matter of fact, this book I'm offering to anybody who wants it, complimentary.
Yeah, how can people go and get a copy?
They can go to thyroidanswers.com. You're going to have to pay shipping and handling, which is $8.95, but you'll get my hardback book. And I want you to have that because I know you or some member of your family or an associate has this problem. 1 out of 3 Americans have the symptoms of low thyroid that goes unrecognized and undiagnosed.
Yeah, well, I mean, obviously you're very passionate about it. You're traveling around the country talking about this. What kind of stories have you seen from women who, you know, were dealing with this for so long, but once they found what was really going on, it just changed their life?
Well, that's why I'm out on the. That's why I'm out on the road, because that's what our guests tell us. This is one thing they say: "Thank you for giving me back my life." And this is after they've been put on tons of pharmaceutical medications, which we don't do. We help them get off pharmaceutical medications, and then we get them on natural thyroid, bioidentical hormones, support the adrenal gland, good eating program, vitamin and mineral supplementation. So we take a natural approach to health.
Is there a certain age that women should start thinking about this?
Well, it can happen in childhood, happens at puberty, commonly happens after childbirth.
All right.
That's when we see it.
All right. Well, thank you so much. We appreciate you being here, Dr. Hotze, and all of your advice. And thanks so much to the Hotze Health and Wellness Center, of course, for sponsoring the segment. For more information on the website, you can go to Hotze, which is spelled HOTZEHWC.com. It's right there on your screen, or you can call 877-698-8698. And we have copies of Dr. Hotze's book to give away. Just text the word healthy to 25543 by 3 p.m. today. You must be 18 years or older to enter. 10 winners are going to be chosen at random. But keep in mind, you can always go to his website and you can get a copy of the book if you pay shipping and handling. So there's lots of opportunities to learn more about hypothyroidism.